Well, so the general question that I had asked, and then after this one question, we'll turn it over to the students. Is really how do you balance the needs of the nation in
Right.
addressing things like COVID, for example,
Right.
while also supporting South Carolina in particular.
Well, you have 50 states with 50 different economic interests, different infrastructure needs. We need roads and bridges in South Carolina. We need to get the port deepened. It's the economic engine of South Carolina, the Port of Charleston. It needs to get to 52 feet in depth to take the ships on the ocean that deliver goods are going to be 3 times in size of what they are today. These Panamax ships are going to have 3 times the cargo capability. So for Charleston to accept these ships, they got to deepen the harbor. Well, how do you do that? If you want your harbor deepened, you got to help somebody else deepen their harbor. If you want to get road money for South Carolina, because we've got a lot of growth in Myrtle Beach area, you got to help somebody else with their road needs. Here's what I've learned in politics and life. If you want something good for you, you're more likely to get it if you can get partners. But when it comes to the legislative process, if you want to get good things for your state, you got to be willing to help people in their state. They're more willing to help you.
Thank you, Senator. So, because I know you have a vote, I'm going to turn things over to Julie Firetag, who's taking the student questions, and she can let them get right to you because I want them to have the opportunity to ask the questions that they have.
Hello, Senator Graham. I am Ayola Oludemiji, and my question is, I noticed in a recent article that you believe that suspending work visas have chilling effects. Could you please elaborate with your stance on the topic?
Yeah, that's really a good question. So we have a very big economy, the largest in the world. We have a declining population. In 1950, there were 16 workers for every Social Security retiree. Today, we're down to 3 workers for every retiree. In 20 years, we'll be down to 2. Families are smaller today. People are having, I'm part of the problem. I don't have any kids. Tim doesn't have any kids. We're part of the problem. Families are smaller than they used to be, and the workforce is declining in numbers here in the United States because our population growth has declined over time. So how do you supplement your economy when you can't find people in the United States to do a particular job, like meat packing, agriculture, tourism? There are certain jobs that people would die to come here to work as a temporary worker. They'll make more money working in America picking peaches and lettuce than they will make in a month where they live. That allows American agricultural companies to hire labor they can't find here. To get a temporary work visa, the company has to show they can't find an American to do the job at a competitive wage with benefits. We don't have enough computer engineers and computer STEM people, science, technology people in our university system to meet the demand. So the H-1B program allows us to bring people in from India and other countries, highly talented people in science and technology and engineering and math, to make sure American businesses have the workforce they need. Again, the first crack at the job goes to an American. If we shut these programs down, then you're going to have farmers who won't have the people to pick the crops. You're going to have technology companies that are going to have a hard time growing in the United States, and they're likely to move to a country like Canada where they have pretty unlimited work visas. Work visas are designed to supplement the American workforce, where a company cannot find an American worker at a competitive wage. They can apply for these visa programs to make sure they'll have enough people to keep the company in business. And if you shut this program down, I don't think it's going to increase employment opportunities. A lot of people out of work today are not going to go into the agriculture business. They're not going to go to meat houses and slaughterhouses, and they probably don't have the skill set to go into the high-tech stuff. So the people who've lost their job to COVID, my goal is hopefully to get their job back. But there are a lot of jobs in America that if it weren't for work permits being allowed to supplement the American workforce, the company would have a hard time staying in business in the United States. When you shut those programs down, I think it's going to hurt economic development.
Yes. Good morning, Senator Lindsey Graham. My name is Hersh Patel, and I'm from Orangeburg, South Carolina, representing Edisto Electric. My question to you is, what is voting going to look like in November, and how can we ensure that all votes are going to be counted amidst the coronavirus pandemic?
This is really a good question. I think you're going to have, they changed the law for the primary so that basically you can vote, you can go vote early. You can early voting. I did that. I voted a couple of weeks before the election, so I didn't have to worry about showing up on election day. You can go early where there's not a whole lot of traffic. You can physically show up early voting. You can vote absentee now. You know, get an absentee ballot, send it in the mail. But you also want to create voting on the day in question. I don't know where the virus will be in the fall. I really don't. I do know that the day that we can get a vaccine on the horizon, that then we'll turn the corner on the virus. Without a vaccine, it's going to be hard to go back to normal. But no matter what happens, we're going to have an election in November. It may be different, but my hope is it's going to be honest, and everybody's going to get a chance to vote. So I think what you'll see in November is more absentee ballots, more mail-in ballots, and you'll have polling stations that are designed to keep people socially distanced and deal with the virus. So I'm confident we're going to have a good election in November.
Yes, I was wondering, Senator Graham, why you didn't support expanding Medicaid into rural areas, despite the fact that there's a large need for affordable health care in the poorer areas of FC who don't have access to the same health care that we have in big cities or the more urban areas.
Well, access to health care is different than who pays for it. So I agree with you that we need more access to health care. Medicaid is a program to provide health care to kids and some adults who are in a poverty, low-income situation. So the federal government basically picks up the tab. It is a matching program. Most of the money from Medicaid payments comes from the state with a match by the federal government. It's the number one expense of the state budget. If we expanded Medicaid, that would put more pressure on the state budget. There'd be less money for schools. There'd be less money for law enforcement, less money for environmental protections. So I don't want to expand. Okay. Can you hear me?
Yes, sorry.
Okay. I don't want to expand Medicaid because that's going to put a lot of pressure on the state budget. What I want to do is offer alternatives to people who make more than Medicaid eligibility. What do you do to people who make too much money to be on Medicaid, but still are economically distressed when it comes to health care? So I would love to have health savings accounts where people can take some of their pre-tax dollars and put into an account that will give them purchasing power. Community health centers. These are government-backed programs, but private sector partnerships. More community health centers in rural areas. The lack of access to health care is a different question than who pays for it. When it comes to Medicaid being expanded, I'd like to have alternatives to the federal government Medicaid program that I think is very expensive, puts a lot of pressure on the state budget. Expanding access means having more doctors and medical people going into the underserved areas. I think the model that's worked the best in South Carolina is a community health center. It's not a big hospital. It's bigger than a doctor's office. And I'm encouraging President Trump to go big on community health centers. And Senator Scott helped President Trump create opportunity zones. These are urban and rural poor areas, underserved economically, where we'll give people tax breaks to go in and create jobs in these areas. I told the president you should use the opportunity zone model to expand broadband. Wherever we have these opportunities zones, create broadband that the co-ops can help us with, so the internet will be available in real time at the highest level, and also put community health centers in these opportunity zones. I'd rather do that than expand Medicare.
Yes. Senator Graham, I am Lando Latham, and I wanted to ask you, how far are you willing to go to unify the American people for the American problem of systemic racism?
Well, here's what I would say. America is not a racist nation. There's racism in America, but it exists all over the world. Travel with me, and I'll show you countries that have racist policies, usually based on religion, where if you're a certain faith, you can't do this versus you can't do that. We have a problem with the police in America. Tim Scott is an African-American United States Senator from South Carolina. I'm a white Caucasian senator from South Carolina. I've never been stopped on Capitol Hill. Tim has been stopped 7 or 8 times. African-American men, and I'm sure people of color in general, but particularly African-American men, have a talk when they get to be teenagers about how to behave around police. If you get stopped, that's an experience I've never had as a white guy. And we've got to admit we got a problem in policing. I think most cops are great, but we need to change our system to reinforce the fact that the police officers need to look more like the community they police. So we need more minority officers. We need better training. We need to really impress upon cops deadly force is available, but it should be your last resort. We need to increase minority hiring. We need to make sure that as many police as possible come from the community. Even if you're from the community, you're going to have a different view of how to police the community than if you're some outside person. I'm willing to change the law to make lawsuits more available when there's an excessive use of force claim. Qualified immunity has gotten to be a giant impediment to bringing suits that are legitimate. So I'm willing to engage in legal reform. I'm willing to spend money to incentivize better policing. I'm willing to outlaw chokeholds. But the idea that America is a racist nation, don't buy it. Our systems can always be made better. And that's where I'm coming from. And unfortunately, we're not going to be able to even debate that topic because our Democratic colleagues are not going to let us go on the floor. And I just don't understand that. After Mr. Floyd, we need to do better.
Senator, do you have time for just one more question from our students?
I do.
Thank you.
These are great questions, by the way.
Senator Graham, right now there's a growing opioid crisis in this nation, and I was wondering, will the federal government send aid to help those who have passed away because of the epidemic, but also will the pharmaceutical companies be held accountable for all the death and destruction that they have caused?
Well, good question. We have basically, if you get an ankle twisted, they'll give you a bunch of, opioid derivatives. We hand out pain medicine like it's candy. If you don't change medicine in terms of flooding the market with these drugs, you're going to have this problem. We spent $60 billion last year trying to create systems that will deal with treatment, prevention, treatment, and deterrence. We got to change our laws. Fentanyl is a speck of fentanyl will kill everybody on this phone 10 times over. So that's gotten into the drug community where this stuff is laced with a very addictive substance called fentanyl. We need more penalties for the drug pusher. We need more treatment early on and prevention programs to let people know if you start taking these pills, it can ruin your life. And this is every demographic. You've got people who've never had a run-in with the law, get hooked on this stuff, and they wind up losing their ability to go to work, stealing, and their whole life collapses. It's been a major nightmare, particularly for rural areas. And the methamphetamines, but now it's oxycodone. And so, yes, pharmaceutical companies need to answer for their basically just flooding the market with these pills Doctors have got to stop prescribing so much of this stuff. And if we don't do that, you're going to lose a whole generation of workers. And we spent $60 billion last year, and I'm hoping this will make some inroads.